Today we're going to discuss the connection between dental health and breast health. Let's get started. First, let's talk about dental connections. Dr. Reinhard Bohl, a German medical doctor and dentist, discovered in the 1950s that every tooth relates to a specific meridian. Kim Bong-han, a Korean physicist, proved that meridians discovered by the Chinese and used for thousands of years in acupuncture and traditional Chinese medicine existed. He injected a radioisotope into an acupuncture point, and the imaging technology showed a system of ducts that connect with every cell nuclei in the body. The system did not follow an artery, vein, or nerve path. They were distinct energy pathways. Every tooth is on a meridian pathway, so infected teeth or one that has had dental work can block that energy pathway. There are 8 teeth connected to breast cancer. Root canals on these teeth are dramatically linked to breast cancer and a history of health problems. As you can see, we've highlighted the specific teeth that correlate to breast health. Thermographic imaging. This client presented with an unknown, not previously identified dental issue on the right upper side of the mouth. We suggested the client see their dentist. It was discovered that a very small infection had started in the gum area. In conjunction with their dental therapy, we suggested oil pulling to help eliminate the infection faster. Root canals. There are about 24 million root canals done in the U.S. alone every year. They were proven deadly disease agents in 1925 in a study by Dr. Weston Price and 60 prominent researchers. Now let's discuss root canals and thermographic imaging. This client here presented with obvious infection in the lower right side of the jaw. She reported having a root canal on a tooth in that area approximately 20 years earlier. She was unaware that there was still any infection involved in the area. Subsequently, we identified a potential issue in her right breast. Your breast health is directly correlated to your dental health. Dental cavitations. The images here show a client who had been having some pain and discomfort on the left side of her mouth. Although she came to us for a breast thermography, we offered to look at her mouth and discovered that there was in fact some type of abnormality in the left side of her jaw. This turned out to be 4 cavitations, which are hidden infections where the bones fail to heal properly. This is most commonly after surgical removal of teeth. These cavitations can lead to a myriad of illnesses and symptoms from fatigue, weight issues, unexplained inflammation, and anemia. After discovering there was an issue, this client was able to contact her dentist, who took a closer look and subsequently healed the areas in question. The negative symptoms that were being experienced disappeared. The dangers of whitening. The use of whitening products for your teeth is a popular option. Notice the halo of increased heat, the orange color, that surrounds the mouth area in the thermography image below. That is the gum tissue. Anytime you are using a whitening product, you are using a corrosive. It does not matter whether it is a tray from your dentist or baking soda in a homemade recipe for toothpaste. A whitener in any form is a corrosive. Anything that can whiten must be able to eat away at stains. The halo of irritation simulated by the dark orange coloring is where that whitener surrounds the mouth area in this thermographic image. This is where that whitener, or corrosive, can sit all day and slowly eat away at your gum tissue. You do not have to abandon the use of these products, just do a better job of removing what's left over after rinsing. To do that, we recommend using a clean cotton swab. Swipe around the perimeter of the mouth, between the cheek and gum, and then rinse again. This will remove the residual and let you still accomplish getting those pearly whites white while protecting your gum tissue. Now let's touch on dental protection. First, let's talk about oil pulling. The ancient practice of oil pulling can whiten teeth and improve gums and oral health by reducing bacteria, plaque, and infection in the mouth. Put 1 to 2 teaspoons of coconut oil into the mouth. Swish for 15 to 20 minutes. Next, spit oil into a wastebasket. Rinse well with warm water, and be sure to brush your teeth after. Never swallow the oil during or after your oil pulling. You will be swallowing the impurities that you have just removed from your gums. Although oil pulling promotes a positive feeling in gums, swallowing the oil will produce an unsatisfactory response from your digestive tract. Saltwater rinse is another great option. Unrefined sea salt is an all-time favorite that no one is passing down to the next generation. It is a major player in your fight against dental infections. There are many testimonies of abscesses, knockout dental pain gone in 2 minutes or immediately. Do not take this idea lightly. Use only unrefined salt. Xylitol. This is a natural sugar made from fruits that can actually kill the strep and lactobacteria. Europeans use it in everything because it is a sweetener with 40% less calories than sugar. Xylitol naturally fights bad breath, inhibits plaque formation, reduces tooth decay, fights ear infection, helps remineralize enamel, and even has been shown to increase bone density by 10%. Here are a few other ideas to help improve your dental health. Consider using smart silver. Several times a week, use a small amount of silver solution to rinse your mouth for 30 seconds to 1 minute. Good quality hydrogen peroxide diluted with water is also a good choice. Do not buy cheap hydrogen peroxide. Use only food-grade quality. You can also buy a 3% hydrogen peroxide, paying special attention to the dilution directions. Make sure you are killing germs. Do not wait and let infection set in. 10-in-1 from GBG is also an outstanding choice for swishing in your mouth. To conclude, protection is always best. Your best dental strategy is to always be in protection mode. We must teach it to all of our loved ones and help protect teeth at an early age. Go to a good holistic dentist before you have anything done to your teeth. They will be able to check to see how you will react to different materials. And don't forget, schedule your annual thermography scan to check for any new dental issues. For more information, visit us online at www.bodybreastscans.com.